Flexion abdominal position pullovers to progressive pullover presses. So in the flexion abdominal position, you start with your hip towards the wall, rotate your body around. Your butt's going to be about 6 to 8 inches from the wall. Feet are going to be level with your knees, hip width apart, and your knees are hip width apart. We want to keep that kinetic chain from the ankle, the knee, the hip, all the way into the shoulder established. From this position, the arms are out at a 45-degree angle to start, palms up. This is creating thoracic extension. We're posterior rotating the pelvis and promoting deep, proper hip flexion. And so what she's going to do next is she's going to bring the palms of her hands together, interlocking her fingers. And the pullovers are just keeping the elbows locked and reaching above your head towards the ground. And so the most important thing at this point is that you keep the elbows locked out, reach as far as you can without creating any pain, and see if you can touch the ground if possible. If not, work your way towards it. As you can see, when she does a pullover, she's creating even more thoracic extension. The scapulas are really getting big movement in it, so we're repositioning the shoulder joint and those scapulas. And we're really getting the muscles around the scapula to glide and those fibers to work a little bit better while we're engaging the extensors of the back. So the next phase is we'll put a block here, and she's going to reach, if your therapist has prescribed it, into the block and press down with about 30% of her strength. As she does it, you can see even bigger thoracic extension, really engaging the extensors of the back, and you can feel those back muscles really nice and strong, and then come back up. She's going to go down for about a count of 3. 1, 2, 3, back up and stop at the center. If you don't have a problem keeping the elbows locked out and you have good range of motion, go ahead and take the block away, reach into the ground and press. So the same thing, 1, 2, 3, 30% of the strength, and you can really see, once again, really engaging those extensors and really repositioning the shoulder blades and the shoulder joint. And you're going to repeat as your therapist has instructed, and these are flexion abdominal position pullovers to progressive pullover presses.